Typically, children get sick in the evening, and for us, it's always been on the weekend, the most inconvenient time. And the fact that there's an after-hours and weekend clinic available, it puts my mind at ease.
I think one of the most beneficial things about coming to an after hours is avoiding the ER. Whereas even if, let's say, she had a fever, I would have to go to the emergency room, wait hours in there, and finally be seen by someone that may not be able to give the answers that are specific to my daughter's health, which is something my pediatrician would know.
Children, especially smaller children, young school age and before school age, and for sure infants, really deserve care by a pediatrician. That's perfect. Again, and again. Very nice. Oh, your lungs are looking great. Pediatricians in the community know that when their office is closed, if they can have their child seen by a pediatrician, they really know what they're getting and the level of care that they're getting. So I think we offer a service that's not otherwise available. Now, how are you doing these days?
Good.
Good? All right. Is your cough better?
Yes, much better.
Wonderful. Say a big ah.
Ah.
All right, that's great. Here at Pediatric Urgent Care, it's kids only, and all kid-oriented staff, only pediatricians staffed by board-certified or board-eligible pediatricians.
You are treated more like a family when you come into this clinic. We approach you like we would our own child versus a real clinical hospital type environment. We try to make sure the child feels very comfortable, is reassured everything's going to be okay, and we take very, very good loving care of your child when they come in.
I think what's unique about Pediatric Urgent Care is that, relative to other urgent cares, it's open later, and it's open every single day, including holidays. And it's the first pediatric urgent care of its kind, especially in Oregon and the Northwest.
Here at Pediatric Urgent Care, we're really set up to deal with anything urgent and emergent. If your child is not breathing, or if they're having a seizure that won't stop, those would be a couple conditions I would say just call 911 and get an ambulance ride to the emergency room. But anything else we can take care of here. We treat a lot of asthma, wheezing, bronchiolitis. These are kids who are struggling to breathe, but we have the oxygen, we have the nebulizers, we can take care of this crisis. And if it turns out that it's much more severe than an urgent care can handle and the child will need to spend the night in the hospital, we arrange for that as well and have a direct admission to the hospital and speak with the hospitalist and make those arrangements. I should stress follow-up here at Pediatric Urgent Care will always be with the child's primary care physician. So we are not in any way trying to see patients during hours that the doctors are normally open. We made a specific conscious decision to set our hours when doctors' offices are typically closed. And that's why we chose evening hours during the week, 7 to 10 p.m., and on the weekends, 1 p.m. till 9 p.m. Most offices, if they even open on the weekends, it's usually in the morning. We'll also be open every holiday, Thanksgiving, Christmas, New Year's, every major holiday from 1 to 9 o'clock.